My name is JaMya, and my innovation was a video protocol to reduce anxiety among patients. And just to introduce you guys to why I did this, I was interning here at Cox, and there was a patient who was going to get an angiogram done, and she seemed very nervous about the procedure. And nothing was done to calm her down, and the only thing that was said by a nurse was, everything's going to be okay, this is a routine procedure, a lot of people get this done. And the lady just seemed still very nervous and very anxious, and I tried to sit down and talk to her about something else to get her mind off of it, but I could tell that she just really wasn't understanding anything, because I think that she was from somewhere else, and she just wasn't understanding what I was saying to her. So that was why I wanted to do this video. So how does anxiety affect a patient? So as I said, when I was in my internship, the lady was just very anxious, and I spoke to some other people who were anxious during their procedure, and they said that the anxiety made them feel sicker than they already were. And anxiety can make a person feel nauseous, and in heart patients, it can make them feel worse than they already do, and the pain worse than it already is. And the main thing that I focused on in my video was a coronary angiogram. And a coronary angiogram is where they insert a catheter into the femoral artery, and it goes up through the artery and into the heart to see how the heart contracts and see if there's good blood flow to the body. And so today's methods of delivering information to patients is a Tiger video. A Tiger video stands for telegraph-initiated guided response. And this is a very general video, and it's just has a doctor explaining what the procedure is and a simulation and stuff like that. But it's not really personalized. It doesn't have any other patients in it talking about what the procedure is and how their experience was. And then there's a difference between inpatient versus outpatient. So inpatient receives generally less information than an outpatient does, because everything is rushed and they're not really getting to sit down and talk to a doctor, while an outpatient gets the same information from doctors. When they come in and they're telling them about the procedure, they get the same information from everybody. And so I interned at the cath lab, and I got to see many angiograms being done, and a nurse actually sat me down and explained why an angiogram was done. And it's because some people are having a hard time breathing, they're having chest pain, they don't know what's happening with them, that's why it's done. And she explained to me what it was in simple terms, so I would understand it. She explained to me why it happened, where it happens, and she showed me the tools that they use for the procedure. She showed me the room where it's done, why they use the things that they use. So it really helped me out with my internship, or with my innovation. And so I did interviews with the cath lab manager, and then I did interviews with previous angiogram patients. The cath lab manager, I wanted him to use very simple words so people would understand why they were doing the procedure and what it would be done for. And then I asked the patients who have had the procedure done, I asked them what did you get from it? Why do you think it was done? What was done to you? Your overall experience of how you felt. And so I made a video. This is in its very early stages.
In the cath lab at Cox Health in Springfield, Missouri. And the angiogram is basically taking a picture of arteries in the heart and seeing whether or not there's good or bad blood flow, if there's a blockage or not. So if the artery is blocked, then we put a balloon in it to pop it open, and then we put in a stent to keep it open, so people can have good blood flow to either their heart, their arms, or their legs.
Yes, I had an angiogram about 9 years ago. I had something called pericarditis. I was in the hospital for a couple of weeks. I was asked to watch a TIGR video prior to the procedure. I did watch the video. I thought it was a little confusing. It actually scared me probably a little bit about how they would do the procedure. I heard all sorts of nightmares and stuff about going up to your groin and stuff and it being painful. I'm also allergic to iodine, so that concerned me also. They told you just the procedure and how they could do it. The information, I think, probably intimidated me a little bit when I watched it back then.
I was admitted to the ER in the evening, and they said they wanted to do the angiogram the next morning, but no, I was not given. They just told me what the procedure was and how it went about it, and that was all they did on that.
Usually people come for angiograms when they're having symptoms that are common for a blockage in the heart. Chest pain is the most common one. It's a classic one. People also have problems like shortness of breath. They get tired easily. Things like that. If we think it could possibly be their heart, then we do an angiogram.
I think the video was probably more consuming and concerning than the actual procedures. I would tell them to ask somebody else that's had it done, and depending on what they're having it done for, and maybe their age too. I was pretty young when I had it done too. I know that if you've already had like surgeries, open heart surgery and stuff, then it affects you differently because you're used to pain in a different way probably. So I had surgery on my heart prior to that, but it was a catheter and stuff in my heart, so it wasn't like open heart surgery or anything. So it wasn't as probably as concerning for me as would be others.
All right. So that was my video, and obviously, like, that's not like a finished product, and there would be a lot of work that needs to be done with it. But like some of the things that I wanted to talk about that was in the video, I asked the doctor to use very simple words, and as you can tell, like, he used simple words like a blockage, but he explained what it was and like what a stent is used for. He said to pop open like the artery and stuff like that so you could get good blood flow throughout the body. And also, one of the former patients said that he would definitely ask somebody else who had the procedure done because it made him feel better. His father actually had the procedure done, and he told me that that made him like less anxious about the procedure because he had already known somebody who had it. And the difference between my video, as I told you before, is that I actually have like former patients that have had the procedure. And some important aspects of the video that I would like to have were having the medical professionals to explain it just using simple terms and not using like acronyms or hard terminology that the patient wouldn't be able to understand. And having previous patients that have already had the procedure done so they can explain their experience and the effect that it had on their life. In a relaxing environment, not an area that is like very sterile or an operating room like that, because then they'll start thinking about like, that's where I'm gonna have it. They're gonna start like searching for something to worry about. And then use calming colors like lavender or blue because those tend to calm people down and make them less anxious or nervous. And then in conclusion, like patient information is vital for somebody to like know what's happening, and so that they're like less anxious about wondering what is going to happen when they get the procedure done. So providing this video would relieve anxiety by having them receive the information through the video from patients and from a medical professional by using plain language, and then having people who have like had the procedure done knowing them already relieves anxiety. So this video would like have them know somebody who has had the procedure done. And also, I would like to thank everybody who has helped me with this innovation. Thank you.